24 years old, bright, attractive, always has drama going on in her life. She's insanely jealous of her boyfriend, and there have been numerous occasions where he's found her with an empty bottle of pills after a fight, and off to the emergency room they go. When her family goes out of town on vacation, she's a mess. She's filled with panic, anxiety attacks. She also has self-destructive behavior, like driving drunk. A couple times been kicked out of bars for bar fights. What is wrong with her?
Nothing.
Mr. Toastmaster, fellow Toastmasters and honored guests. Amy has been diagnosed with borderline personality disorder. Now, this is a psychiatric diagnosis affecting only 2% of the population. That's still 6 million people in the United States. Typically, the frequency in women is 2 to 3 times greater than that of men. Now, many clinicians object to the negative connotation, borderline, the misunderstood, outdated use of the term, but it was given the name back in the 1930s because the disorder was considered on the borderline between neurosis and psychosis. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, is published by the American Psychiatric Association, and it's the primary system used to classify and diagnose mental disorders. And according to the DSM, borderline personality disorder, or BPD, is characterized by a pervasive pattern of instability, of interpersonal relationships, self-image, and impulsivity, beginning by early adulthood. And it presents itself in a variety of contexts, as indicated by 5 or more of the following 9 symptoms, according to the DSM. 1, frantic efforts to avoid real or imagined abandonment. In fact, there's a book on the subject titled, I Hate You, Don't Leave Me. 2, a pattern of unstable and intense interpersonal relationships, and it's characterized by alternating between extremes. Ideation on one side, great admiration and love. Next day, it's devaluation, intense anger and dislike. Number 3, identity disturbance, a markedly and persistently unstable self-image or sense of self. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. Number 5, recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Number 6, affective instability due to a heightened reactivity of mood. Intense episodic dysphoria relative to mood. Dysphoria is the opposite of euphoria, so it's that. Or anxiety, irritability, usually lasting a few hours and only rarely more than a few days at a time. 7, chronic feelings of emptiness. 8, inappropriate, intense anger or difficulty controlling anger, frequent displays of temper or even recurrent physical fights. And finally, number 9, transient stress-related paranoid ideation or severe dissociative symptoms. Now what that basically refers to are just degrees of paranoia and just disruption of mental processes. Put in plain English, the symptoms a person suffering with borderline personality disorder includes an inability to regulate their mood. They experience extreme shifts in their trust and perception of others. They have intense and stormy relationships, self-injury, and low self-esteem, coupled with these feelings of anger and abandonment. They have problems making stable attachments to others, and they're prone to black and white thinking. Somebody's either all good or all bad, and that's called splitting. So their behaviors, relationships, and emotions are highly erratic, and they often alienate anybody trying to help them, even their therapist. Impulsive behavior might include excessive spending, promiscuity, gambling, drug or alcohol abuse, shoplifting, overeating or other eating disorders, driving recklessly, or, as we said, physically self-damaging actions such as the recurrent suicidal gestures or self-mutilating behavior, such as a cutter. Symptoms seem to be most acute when people with BPD feel isolated and lacking in social support, and it may result in frantic efforts to avoid being alone. Even with family members, individuals with BPD are highly sensitive to rejection, reacting with anger and distress to such mild separations as a vacation. The most recommended form of treatment I found in my research is a psychotherapeutic treatment called dialectical behavior therapy, DBT. Now, this was designed specifically to treat this disorder. It's generally conducted through individual and group counseling sessions over a very long period of time, and basically uses a skills approach to help the patient learn to regulate their moods, tolerate stress, improve their relationships, and just stability. Now, I have a close friend who's diagnosed with BPD, and doing this research has helped me understand her condition a little better and relate to her better. Now, I've given you a brief overview of a complex and even controversial disorder, but I trust that I've given you enough information if someone in your life exhibits these symptoms that you will know what it is. Mr. Toastmaster.